Nursing homes and assisted living facilities were seen as hotspots during the height of the pandemic. Now, cases have declined significantly, but there are still scattered outbreaks across the country. The reason, the CDC says, is that not enough workers are vaccinated. MSNBC anchor Yasmin Vossoughian joins us outside an assisted living facility in Chatham Township, New Jersey. Yasmin, good morning. So what is the current situation with vaccinations there? I mean, I'm surprised to hear that it would be that workers are kind of the issue.
I mean, look, there's still some vaccine hesitancy when it comes to healthcare workers across the board. We've seen that in many studies as we've been looking at vaccine hesitancy in this country. But if you think about some of the numbers, I mean, it was ground zero in some of these nursing home facilities and assisted living facilities throughout the country. 130,000 plus residents died over the last year. 1,900 plus staff died because of COVID. And now you're kind of seeing these breakthrough infections, much of which is being attributed to some of these staff members not getting vaccinated. If you take a look at what's happening in the state of New Jersey, in general, 80% plus of residents in some of these facilities are vaccinated. Only 60% of staff members in some of these facilities are actually vaccinated. And so they're attributing these kind of cluster breakthrough infections to the lack of staffing that have been vaccinated, and because of also the uptick in variants. I mean, think about it. You have vulnerable populations living in some of these assisted care and nursing home facilities. I want to bring in Lynn Katzman, who is the CEO and founder of Juniper Communities. This is one of the communities that I'm standing in front of right now. I'm in New Jersey. Lynn, great to see you this morning.
Thanks you for having
us on this. Now, you have taken a different approach to this because some facilities do not require their workers to be vaccinated. You, however, say, listen, if you want to work at one of our facilities, you need to be vaccinated. Why?
Well, we had a singular strategy that began at the beginning of the pandemic. We wanted to promote well-being and protect health. And I think our entire strategy has been dedicated to doing that. Vaccination is one of the final steps we took in making that happen. Initially, we started with widespread testing, universal testing, because what you need is data. Right. If you want to fight a pandemic, you need to understand how it's acting, where it is. And that gives you the information to protect the people that you care for and that work here, frankly.
So when you made this policy change, come November, you made the decision.
We did.
Early on, well before the vaccine was even sort of put on the market. What did your employees have to say? Did you lose folks to that?
Let me come back to the number we lost, because it's very, very few, relatively speaking. The decision was made collectively. We put together a group of people from across the company, from different functions within the company, so wellness, environmental services, leadership. All of those people came together to direct our pandemic strategy, and the decision was made universally. Everyone wanted this to end. We needed to see hope, light at the end of the tunnel. And so vaccination for our entire team was, we believe, that light at the end of the tunnel. So we made that decision collectively.
And have you lost any employees because of the decision?
We have lost just over 1% of our employees,
so
30
many
people out of 25 communities, so one in a few at most of our communities. So it's been very, very, very little.
And Savannah, what we're not talking about that needs to be said is hundreds of residents are still dying across the country because of these breakthrough COVID infections. But interestingly enough, you've not had one death in this facility since April.
That's correct. That is correct.
And you attribute that to?
We attribute that to our strategy, which in April was not vaccination, it was testing. So we've been testing either once or twice a week for anyone coming in. You were tested this morning.
I was, yeah.
So we continue to test out of an abundance of caution to make sure that we have the information we need to protect the vulnerable folks that call us home.
Yeah, interesting. Lynn, thanks so much.
Thank you
for letting us be out here all day. We appreciate it.
We're thrilled to have you. Thank you.
So, Savannah, it's interesting, right? Because Lynn and her community, they've taken that approach, right? We actually spoke to an advocate for nursing home facilities yesterday. My producer actually did. And it was fascinating because this advocate actually said they think it's a slippery slope to, quote unquote, require. They're not necessarily requiring folks to get vaccines here. They're saying, listen, if you want to work here, you got to get a vaccine. But to require folks to get a vaccine to work in these facilities, which I thought was fascinating. It is a different approach, right? More to encourage folks, to tell them, listen, it's safe, it's effective, and this is why it's important for you to get the vaccine. But to actually require folks, they are against. So So, different philosophies here, but nonetheless, folks are still dying across the country in some of these nursing facilities, and it's because of these breakthrough infections and from staff members not getting vaccinated. This community behind me, though, one of the communities that is saying, if you want to work here, you got to get vaccinated in order to keep the residents here safe, Savannah.
Yeah, Yasmin, I mean, so good to hear that they have been able to keep it under control, and an important reminder that testing can still be incredibly helpful even as these vaccines start to ramp up. So let's talk, though, about why there is this lower rate of those vaccinated among workers at these facilities. What's behind this trend nationwide? I mean, it's great to hear they haven't lost a lot of their employees, but they've lost some because they don't want it.
Yeah, it's vaccine hesitancy. I was in, I think I spoke to you guys from Mississippi a couple weeks ago, and we talked a lot about vaccine hesitancy in the black and brown community and also amongst white conservative men specifically, but also in the healthcare community. We're seeing across the board vaccine hesitancy in the healthcare community. And some of the folks that I've been speaking to that work in the healthcare community also say, listen, this is a wait and see moment. We want to wait and see how folks are reacting to this vaccine. So they're not necessarily immune in the healthcare community to this vaccine hesitancy. We heard from the president yesterday when he held his press conference around 2 p.m. yesterday, talking about the push to get as many Americans vaccinated as possible by the month of July, right? Wanting to engage in barbershops, as you were just speaking to Blaine Alexander, keeping pharmacies open 24 hours a day, 7 days a week, making sure they can provide child care through Bright Horizons for free, Uber, Lyft, right? Providing free rides to get vaccines. So it's this major push across the board to get as many Americans vaccinated as possible. So it's not just affecting nursing facilities like this and assisted living facilities like this, but really across the board, Americans in general. But again, the healthcare community not immune to this idea of vaccine hesitancy, Savannah.
Yeah, it's an interesting point. Yasmin, thank you so much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.